Yeah, okay, cool. So, hi, my name is Bridget, and I'm currently in my fifth year of medicine at the University of Edinburgh. So, in my third year, I integrated in pharmacology. So, I've got a bachelor's of medical sciences in that. And when I did my A levels, you could still do four subjects. So, I did biology, chemistry, maths, and psychology, and then dropped psychology in year 12. So, carried on maths, chemistry, and biology for year 13. So, today we're just going to do a quick sort of session on medical ethics. So just looking at what medical ethics is. So medical ethics obviously describes the moral principles that a doctor sort of needs to conduct themselves, but it's sort of worth noting that medical ethics is like a change in ideal. So what was ethical 30 years ago isn't necessarily ethical now, and what's ethical now might not be ethical in the next 30 years. Can anyone think of any examples of things that you think could have been ethical 30 years ago but isn't ethical now?
Cloning,
Sorry?
like cloning animals,
Yeah. In what sort of sense? Do you want to expand a
like
bit more on that?
or like the idea of cloning human beings. Like today I had biology and I was doing Dolly the sheep and how they cloned that sheep, and they were like, it's not, they've realized that it's not ethically right to think about cloning human beings.
Mm-hmm. Yeah,
So
that's a
maybe
good.
like a couple years before it would have been, they would have thought it might have been okay.
Yeah, that's a good example. Anyone else can think of anything else?
Lobotomies.
Sorry?
Lobotomies. Like cutting off half the brain.
Yeah.
Yeah.
Yeah, exactly. That was something that obviously even leading on to like psychiatric conditions where if you came in with like, mental illness and hysteria, they'd like strap you down and force treatment. And that's obviously something that's not being done again now. Yeah, that's a good one. Anything else? No, but I think most of it, you have covered most of it in the sort of like research studies. So now when, for example, like the COVID vaccine, they were doing it for trials, you have to get people's consent before you obviously start testing stuff on them. Whereas beforehand, they could just get random groups of people and just start testing medications and drugs on them. And that was completely ethical. But obviously now they've come up with the rules that you have to follow as to what to do before you start testing any sort of products on anyone. So within medical ethics, we sort of think about it in sort of four different, they're called pillars. So you've got four different pillars and we'll just briefly go through it. And obviously we can't cover it all in this session, but hopefully in the 2-day session over the summer, we can sort of go into more detail about it. But oh. But yeah, so these are the four pillars. So you've got autonomy, beneficence, non-maleficence, and justice. So I'll just do a quick run through of them. So autonomy means that you give a patient the right to choose what's good for them. And that sort of means that, when someone comes to you and say, oh, I've got a headache, and you say, okay, I'm going to prescribe paracetamol, the patient has a right to decline that and say, you know what, I don't want to take the paracetamol. And you can't force them to take the paracetamol. Say if someone came into hospital and needed surgery and you tell them, oh, to save your life, you need to have this emergency surgery, it's useful, and they say, no, I don't want it, then they don't want it. You can't force it on them. Whereas beforehand, that could have been something that you'd say, I'm saving your life, you're going to get that surgery. So unless someone don't have capacity, so if they've got, for example, conditions like dementia, or they're really young and their parents can make decisions for them, you let someone choose their own treatment and how they want to be treated. The next one is beneficence, which means that you do good and you always promote the patient's best interests. So again, it's the fact that you see someone, they're ill, you tell them these is the best treatment for you. But again, that person could decline it. But it's always the fact that whatever you do, you always need to make sure that you're doing it in the best interest of that patient. And the next bit, you've got non-maleficence, which basically is one of the key. I think when you hear about medicine, they always go, do no harm. And that's basically what that means, that, you need to make sure that whatever you do, you don't cause harm to someone. And obviously, sometimes you can end up causing harm whilst trying to treat someone. So, say in surgeries, when you do an operation on someone, somehow it might end up that you end up, damaging an organ on purpose, or you end up giving them an infection. But that wasn't on purpose. So non-maleficent means that the core aim of whatever you're doing is that you're trying to not cause harm to someone. And the last bit is justice, which sort of talks about ensuring that all patients are treated equally and fairly. So you can't have people that you're going to treat them better because they're your friend's mum or they're your friend's sister, or, you know, you saw them down the street or they look really nice. So, you know, you have to treat them nice, or someone doesn't look nice, so you're not going to treat them nice. You have to treat everyone the same. Talk a bit about an ethical scenario. So you've got two people who need a liver transplant. And we're just going to go through their case. So they've already got one liver, and you sort of have to tell me who you want to give that liver to. So you've got a 40-year-old man who needs a liver transplant because he's got liver damage because he drinks a lot. He's married, he's got a 2-year-old daughter, and his wife is pregnant with a son on the way. And then you've got a little 12-year-old girl who needs a liver transplant because she's got a genetic condition that means that her liver just failed. What do you guys think? If you were to choose and you had just one liver, who would you want to give the liver to?
I think it would be a really hard decision, but
Mhm.
I'd probably choose the little girl because she has a lot of life to live,
Okay.
and it's no fault of her own that her liver has failed. While the man, although he has a family, he has had drinking problems, so he's at fault for his own liver failing. So I thought it would be unfair on the child to not treat the child.
Okay. Anyone else? Gonna go through everyone. So you don't even have to explain. You could just tell me if you had to put yourself in that position. You had to give one person. Who would you give it to?
I would give it to the girl.
You'd give it to the girl. Why?
It's what Christian just said. She hasn't done anything wrong. It's just the way she was born. Whereas the man, he has made his own choices to get where he is today.
Okay. Anyone else? Does anyone give it to the man, or is everyone just gonna go for the girl?
I'm gonna go for the girl.
You're gonna go for the girl.
Yeah, because she's not in the wrong, or she hasn't done anything wrong. It's not her fault.
Okay. So everyone's going for the girl. Right. So did someone say something? No.
Yeah, I agree.
You agree. Okay. So all of you have gone for the girl, which is what a majority of people would do. But if you remember what we're talking about in the last sort of bit when we're talking about the pillars of medicine, one of them being justice, and that was to make sure that you treated everyone the same and fairly. And a lot of you have said, you know, the man, because the reason he's got liver problem is because he's been drinking, it's his fault, which is true, but also you can't not treat someone because their condition is their fault. There's a lot of people, you know, who they've got liver damage or they've got diabetes because of their diet and because they end up being obese. But you can't say, you know what, you caused that to yourself. I'm not going to treat that's your problem. So you have to sort of look at it in a very systematic way. And someone also said the girl because, you know, she's got her life to live, but you can argue so is the man. And you can't really you can't say because someone, even if the man was a 70-year-old guy, an 80-year-old guy, you still wouldn't say because he's old, I'm definitely going to give it to the girl, because you have to think about people's social circumstances. And yes, you're right. The guy with the alcohol, obviously, we need to sit down with him and talk to him about stopping drinking alcohol, because if you give him a new liver and he keeps drinking, he's just going to damage that liver again. And then that was just pointless. So you're going to sit down with him and let him know that, you know, if you're serious about getting a liver transplant, you want it, you're going to have to give up alcohol. And if he's prepared to give up alcohol, then him and the girl on the same standing. As long as he stopped drinking alcohol, there's no more risk factors. No one is in priority. What you then do at those sort of situations is it sort of starts to get a bit more sciencey, where you sort of look at people's blood group, look at their immune reactions. So you look at the donor liver, sort of what blood group is it, what cells has it got, and then you look at the people that want the liver, what cells have they got, and the best person that matches that donor liver gets the liver. So most times it is quite easy to look at people's social circumstances and say, this person's really young, I'm going to give it to them. But because of those ethical pillars that have said that you treat everyone the same, no matter what, doesn't matter their age, doesn't matter their gender, doesn't matter their class, doesn't matter their race, everyone gets treated the same. So you always need to make sure that if there is any social factors, you get rid of them first and then you then put them on an equal piling, and then you go from there. Does that make sense? With that, if we're just going to do a quick sort of going round about the different careers and specialties that you've got in medicine. So I think with most ones, people think about sort of, you've got the GP, you've got obviously you've got people becoming a GP, you've got people working in the hospital, doctors in the hospital, and you've got people working in surgery. And within those sort of working in the hospital and working in the theatre, you've got different roles. So if you're working in the hospital, you can be a pediatrician where you take care of kids. You can focus on being a respiratory person where you look at the lungs. You can go for cardiology where you look at the heart. You can go for orthopedics where you look at the bones. So for almost every part of the body, there's like a specialist area where you can become a doctor in that. And that's sort of the same with being a surgeon as well. So you can be a surgeon for the heart, you can be a surgeon for the lungs, you can be a surgeon for the bones, you can be a surgeon for the head. So there's different areas, but there's also sort of different aspects of medicine that people don't really think about. So the first one is called like pre-hospital emergency care. And I don't know if any of you watch stuff like Holby City and Casualty or stuff like that, or that's just me. But there's people sort of on their helicopters, they sort of do pre-hospital care. So in emergencies when, you know, an ambulance can't get to places. So if someone say went mountain climbing or they're on a hill, or someone lives in a rural place where, you know, it's not a city, you can't really get on the roads there. Yeah, these people coming in their helicopters, they sort of fly there and they provide emergency care to these people. So that's another area that people like doing. Another one is obviously sports and exercise medicine. So I feel like quite a few of you will probably watch football, and you obviously, when footballers get injured, you need people to sort of check them out. So you can work in sports and exercise medicine. You can work for different football teams, and not just limited to football. You can go into tennis, cricket, basketball, all of that. So you don't have to be limited to just working in the hospital. If you're interested in, you know, sports, that's something that you can go into. Then another bit you've got is sort of royal sort of air forces. So you can work in the army, you can work in the navy, you can work in the Royal Air Forces. And obviously with, especially at the army, the soldiers sort of when they get wounded and stuff, they need specialist help and they need care. So you can sort of go around to different countries, help out in wars, but obviously you're not frontline like the soldiers themselves. And then you've also got humanitarian medicine. So there's an organization called Médecins Sans Frontières, which basically means Doctors Without Borders. And they just go to different countries. So they go to sort of less developed countries like, you know, parts of Sub-Saharan Africa, Asia, even some parts of Europe as well, and just sort of help out with these countries that don't have a developed healthcare system like the UK. So obviously you get to travel a lot around the world, help people out. You get to see sort of conditions that aren't so common in the UK. So obviously if you go to parts of like Africa and Asia, you're going to see a lot more malaria, you're going to see a lot more infectious diseases. You're going to see conditions, you're going to see people with sickle cell anemia and stuff that aren't as common in, you know, the European population. And then I think that was it. Has anyone sort of got any questions about medicine, about medical ethics, or anything like that?
What are the key subjects you have to study to do medicine?
Okay, so when I last checked, it's really weird, but when I last checked, chemistry was one thing they definitely want you to have, which is weird because you think biology, but for some reason they don't really care. So I think most unis want you to do chemistry, and then you can do, and then I think then you have to do one of biology, maths, or physics. So I think as long as you've got chemistry and then another science or maths, then you are fine. Anything else? Yeah, I think it's quite, obviously it's a good, year 10 is quite a good time to start thinking about it, but I wouldn't say like, you know, get too bogged down by it because you have got time, you've got like 2.5 years to really think about what you want to do. So I think sort of when you get to year 11, sort of think deeply about what A levels you want to do and sort of think about if you can do those A levels, because sometimes what you want to do and what you can do are completely different things. So sort of work hard right now, like, you know, getting your maths and your science grades sort of up to scratch, so then you can do it A level. And then I think once you start to sort of get to end of year 11, year 12, I think sort of start contacting hospitals for work experience, which is what a lot of people find difficult, but it's something that you just literally just search up hospitals around your area and just message every one of them. and you will get a lot of no's, but some, like at one point you will get some yes, and most unis definitely want you to get some work experience, so that's something you have to try and get. But again, it's not just limited to hospitals. You can go to your local GP and ask them if you can sit in some of the GPs. You can volunteer at like a care home, you can volunteer at like a, you know, a hospice, you can volunteer at like a, you know, an orphanage, stuff like that. Doesn't have to just be a hospital. You can do other sort of caring areas.